Hi, I'm Dr. Vyvyane Loh, and this is my live stream Q&A. I just want to say hi to everyone who is, oh, that was my reminder telling me I have to be on today. I guess I set a lot of reminders. But here I am, and I am eager to meet some of you who have been listening into the podcast and to take your questions. So feel free to send me your comments, send me your questions. You can type that in, and I'll be able to read them. And in the meanwhile, some of the latest episodes that I've done, I've gotten a lot of interest from different listeners, and those have been the episodes on the glycocalyx, the mTOR episode. I just did one on lipoprotein, sort of a basic overview, and it seems hopefully that people got something out of those episodes. And I'd like to know if that's the kind of direction you'd like me to take on those podcast episodes, then I'd be happy to do that. It's, again, I've said this before, hard to decide how much technical detail to include, because I know that some people who are listening in are very motivated by learning those technical details or having an in-depth discussion on those details. And then some people want a more general picture. So it's a little bit of guesswork for me, and I'm trying to learn what people want and what the needs are. So the more comments that you send me, and certainly some of you have asked me for references and so forth, I'm happy to do that. I think on numerous occasions, people have asked me for notes. So I just want to say with the notes, I eventually would love to get to the point where I can provide, extensive notes. Just right now, it's pretty hard because I would be the one assembling those notes at the same time. And I am a full-time physician right now. And so that's a bit of a challenge for my time, right? So I know people have asked several times for notes. Hopefully we'll get there at some point. Okay, so in the meanwhile, it's hard for me to see who is on, but feel free, as I said, to give me your comments or your questions. There's Maya. How are you? Almost done with exams, so that's good, right? Yeah. I had an interview on a, oh, thank you, Maya. I had an interview on a podcast this week, and the interviewer asked me about my own medical school experience, and I basically gave away my own secrets. I was actually not in medical school very much. Oh, Jean, hey, it's so good to have you here. Thanks for joining in. Yeah, I heard you have a a birthday coming up fairly soon, so happy birthday when it does come up. Okay, but it's lovely to see you here. Okay, let's see. What else can we talk about? I think one of the things I want to emphasize for the last few episodes is how much we can miss out if we overgeneralize on certain topics, right? So, for example, with the mTOR, I think a lot of people expressed surprise at the different things that can turn on mTOR, and including cholesterol, right? Uh, it turns out mTOR is a lot more versatile and just a lot more sophisticated than we realize. And so oftentimes when we only focus on one aspect, we miss out on the other aspects. And then we get this very narrow, polarized view, and we miss out on the nuances and the subtleties and just the complexity of the different systems that we have in energy regulation in our body, right? The same with lipoproteins. I just talked only about the sort of lipid transport functions of lipoproteins. And like I said, I will be doing a different episode looking at other aspects that when we look at it, it shouldn't be a big surprise, but at the same time it's never discussed. So one of the things I try to do on these podcast episodes would be to try and highlight um, the subtleties, the complexity, the different aspects, right? Because we're used to hearing about certain things in relation to certain topics, but broadening it out allows us to step back and see a bigger picture. And that's what I'm hoping. Okay. So if there are topics that you want me to discuss, if there are questions that you have for me, again, I'm happy to answer them. I don't know, Maya, if you had a chance to listen to since you had exams recently. But again, I don't know if they teach about mTOR in the first couple of years. I don't know if they ever taught that in med school. Uh, I don't remember. So I wonder what your take on it is. All right. Anything else? Jean, I wonder if, some of those episodes might have been, I don't know if they were something that you were interested in, or if there is a different direction you'd like me to take. I'd be curious to hear what your thoughts are on that. Okay. And okay, so it looks like Maya is saying not a lot of detail with mTOR. Yet it's very, very important, right? Again, it's linked to autophagy, it's linked to growth and proliferation, and when regulated when dysregulated, right, we then can get insulin resistance and other metabolic dysfunction. Oh, Jean asked me to talk about metformin. All right. You know what, Jean? Then you're going to have a whole episode on metformin. That's a complex one because there's so many ways in which metformin works, right? And it's a very interesting drug. Very old, very useful. I'm not always, I don't mind putting people on medications judiciously, using medications in a thoughtful, intelligent manner. I don't like just throwing medications on board for no reason. Metformin is one I really like using, and we'll probably do, okay, yeah, berberine with metabolic health. Okay, so you got that. Definitely will do an episode. And those happen, especially metformin, happens to be a favorite topic of mine. So that's going to be a whole episode at least. And like I said, very many different ways that metformin affects our metabolic health. Okay, so that's a great suggestion. I'm definitely going to include that. All right. And any other thoughts? I actually, for the upcoming episode, I'm probably giving things away. But I anyway wrote about this right in the newsletter, because in the newsletter I give sort of an idea of what topics will be coming up. So I did say I would talk about fat. I didn't say what aspects, because honestly I didn't know at the time when I wrote the newsletter. I hadn't decided yet what aspects of fat I wanted to go into, because there are we probably could just spend the whole year talking about fat itself, the fat cell, different types of fat, and so forth. It's a lot more intricate than it's being presented as usual. So again, When people talk about fat, it's just this homogeneous tissue, which of course it isn't. And even within white fat and brown fat and so forth, there are differences, right? So I will be kind of gathering my thoughts on fat, and also some ways in which we can sort of work with our fat to improve our metabolism, right? So people think of fat as a bad thing, and I actually don't see it that way, even though uh, I am an obesity specialist. So a lot of people think you probably don't like fat, Dr. Low. I actually think fat is very important, and I think it's one of the most important tissues in terms of regulation of metabolism in the body. But how and in what context we have that fat, that's going to be important. So that's going to be in the upcoming episode. I haven't, again, really decided on which particular aspect. Sometimes too many things to talk about. And that's actually the biggest challenge for me in making these episodes, is that, okay, I pick a topic and then I go, oh, now what? Because within the topic, there's a million roads I could go down. And a lot of times try to go down all of them at one time. And then I realize, it's maybe too overwhelming and almost impossible to cram everything in. And then I've learned now to kind of just say, we're just going to pick this aspect and then, deal with it. And then later on, we can do something else. But in the beginning, I kind of always felt this urge to talk about all aspects and try to be complete. And of course, that's crazy because you can't ever really be complete, right? So that's the biggest challenge I have when I deal with a topic. I always go, okay, now there's 6 million things, and then of course they're all linked. So if you talk about one thing, it's also linked to other things. And my interest is also in helping us see those links, not just seeing these things, these details individually, but how they're linked together. So that's the tough part. All right. Okay. So we have the requests on metformin and berberine and metabolic syndrome. Any other thoughts as you guys have been listening in to the podcast? If there's anything that would help make them more enjoyable, maybe easier to digest. I don't know, because I keep hearing that, well, mixed, right? Some people think it's technical, some people think just keep going with it. So, and I'm just feeling my way around. Food additives like coloring, preservatives, flavoring agents. Yeah, and then that's getting into food science, Jean, which is a huge topic. Um, and I definitely, even the things you listed there, right? Coloring would be a whole category, preservatives, flavoring agents, and then there are things to manipulate the consistency of food so that you make a certain texture, right? And also maybe changing consistency, because they've noted that foods that change states in your mouth are particularly addictive, right? So if you think of things like ice cream, it goes from a solid like to a liquid and state, and then chocolate melting in your mouth. So foods that change states in your mouth are particularly addictive. And so in the food industry, there's a lot of interest in manipulating that to get people hooked, right? So that's one aspect of it as well. Um, Besides the flavor itself and the preservatives and so forth. So that would be a good episode. I probably would have to maybe divide things up right? There's so many things in food science that they have to consider. Some of them are regulatory, and some of them are to preserve, as you know, the substances that are in those I suppose food products, and some are just to get you hooked, right? And then there are also additives that are supposed to be good for you, so they try to fortify some of the products because they want to make it seem like this is a good way to get your vitamins or to get your minerals or so forth, right? So there are all those different aspects of food science, and that would be a big topic. Jean, I definitely will be doing that further down the road. I'm making a list, and I'll keep that on the list. So that's a good one. Okay. Anything else? Just looking here. No. Yeah, I mean, the other thing I've been doing is I am working on a book, and that's coming along as much as it can come along, given some of my time constraints. But hopefully I'll get that done in the next couple of months. Working on a book that basically addresses metabolic health and focusing particularly on body composition aspects of metabolic health, right? Uh, and the reason I am doing that is because I think the body composition allows us clinically to be monitoring and assessing the progress of the patients versus, um, just kind of whether patients are feeling better or not. Obviously, we can look at, patients getting off medications, improvement in their labs, and so forth, right? So those things happen fairly early when you correct metabolic dysfunction in a patient. But then as you are continuing to follow the patient, it's really important to make sure with aging that you're going to optimize and preserve the metabolic function of the patient. And it's important then to keep an eye on body composition. Jean is saying that some of the episodes need to be listened to a couple of times. Yeah. Well, thank you for being patient enough to go through them a couple of times. I'm always rushing to get through an episode because I have a time constraint, and also I feel like, oh, I got to get all this information in. So maybe sometimes I cram a bit much in. I'm trying to again feel my way around this. Not great at it yet, but hopefully I'll get better with time, right? So all the feedback is really valuable. Again, you don't quite know what effect you're having unless someone gives you feedback, and then I can adjust and make it more helpful to people listening in. One of the things I didn't want to do with the podcast was to just go over the same olds over and over again, because there are people who are doing a lot of work in the metabolic field, and they have done great work, and they've really kind of opened the medical world up, and also from the general public's point of view, opened up the way for us to talk about and think about metabolic health. So, and then we need to also kind of keep driving home that message, right? So, uh, I think, when I look at other people who are in the field and the work they've done, it's just been tremendous and enormous. And then I thought, well, what's my role? How can I contribute in a meaningful way? And, each one of us doing our own little part. So I thought, well, maybe what I can do is just open up some of the topics so that we see the potential and not just only one aspect of a topic, right? This, especially for people who maybe are interested in health and have already a decent sort of foundation, or also someone who's a healthcare practitioner who wants to open up their knowledge base. And, that way I thought, maybe that's something I can help out with and contribute. So that's basically my focus with the podcast, is to start to take some of these topics that have been discussed a lot and show different aspects of it, show the complexity, and also importantly, linking them. So over time, I'm hoping that people will step back and see how all these things are related, and that it's pretty impossible to only address one aspect or to only focus on one aspect, right? So a lot of times I've been asked this, how to biohack your body. And while I think it's admirable to want to biohack your body, it's pretty difficult because there's so many back roads and back pathways and other systems in place, right? So to try and hack one pathway, what people don't realize is then you just open up five other pathways, right, that will counter your effect and so forth. So, and that's not to say it's impossible, and that's not to say that we shouldn't be doing certain things to try to improve our metabolic health. But I'm just saying it's not as simplistic. And, sometimes people will say, well, you just do X and then everything will get better. And a lot of things might get better, but, you might also be, doing something that will impact your body downstream that was unintended. So that's the kind of, I guess, subtlety that I want people to understand. Oh, good, Jean. That's you're saying that's what you like. Yeah, I just don't want it to be, okay, so eat this, don't eat that, right? Or do this, don't do that. And everything is about context, really. And as a clinician, it's important to know the context and to try to kind of address different situations. So one of the things, for example, that I think I think I will address this a little bit in the upcoming episode when I talk about fat, because again, most people think that we should get rid of fat, right? And that's not true. You don't want to get rid of all your fat, particularly the subcutaneous fat, right? So we know that people with no fat, right, have some of the same types of metabolic dysfunction as people who have too much fat, so that they become insulin resistant and they have a lot of liver fat, right? And liver abnormalities. So you can see that in people who have no fat. And I would argue they're perhaps even sicker than those with too much fat. Okay. So, I again, this idea of, well, we should just get rid of fat and, get rid of obesity. We have to kind of be very careful about that, right? And the other thing also is, with especially with medications and surgery, right? All these ways that we have tried to reduce obesity in patients, uh, you might not be reducing obesity in your patient when you put them on medications, or when you, let's say, do surgery on them. You definitely, and in all the research, what do you see? Mostly you see weight loss. I won't argue with that. You see weight loss. Do you reduce obesity? Well, if you lose weight, but your percent body fat is still high, then we just went from maybe the increased weight obesity model to normal weight obesity model. So, but we're still in the obesity category. You see what I'm saying? So even though people lose weight doesn't mean that they are now no longer obese. And that's why I keep coming back to body composition, because we're so ingrained with this weight model, and it doesn't occur to many people that, well, yeah, they may have lost weight, but they're still obese, right? So then people start patting themselves on the back and self-congratulating, themselves, because, oh, this person lost weight, but you just maybe converted this person to, increase weight obesity to normal weight obesity, right? And you still have metabolic dysfunction. A lot of things may get better temporarily, but long term, that's the part that I think people don't realize. Long term is going to be the key, because things may be better in the short term, maybe the 3 to 5 years, but long term, is that sustainable? And is that going to have consequences that we didn't predict? Yeah. So I keep harping, yeah, Maya. And this is the thing. I hope they start to train people properly in medical school and stop talking about weight per se, and really start thinking about body composition. And your job as a physician is not necessarily just to keep a certain weight range for your patient. Your job essentially is to optimize the body composition and to help that patient stay at optimal body composition so that they can have optimal aging, right? And an optimal health span. So that part, I think people forget. So this idea of, if you lose weight, then everything will be solved. So we should just, make sure everyone can have surgery, everyone can have drugs, whatever it takes for them to lose weight. Well, what's the consequence with weight loss, with no attention to body composition, no attention to nutrient value, right? Because again, they miss the part that, you can be obese and at the same time you are malnourished, right? This is the part I'm always trying to drive home too, because I look at a patient who has obesity, and at the same time I'm thinking about, how malnourished they might be. So at the same time I'm thinking, how do I correct any nutrient deficiencies? Now technically, if you see a patient, generally in the medical world, they see a patient who has obesity, that, what they're going to say? They're just going to say, oh, you need to lose weight. Okay. And the patient comes back. Let's just say the patient comes back, lost 30 pounds. Great. You did a great job. You just lost. Nobody's looking at, well, are you sure that was great? I mean, what did the person do to lose weight? Right. And, how sustainable will that be? And how much malnutrition are we now generating and accumulating in the patient, right? And at some point you'll get metabolic dysfunction that way too, because classically people try to lose weight by restricting food intake. Always been the case, right? Throughout history. Just think about this, right? This is not new. It's not new. Intermittent fasting, or just fasting, or just eating. I mean, ultimately people restrict in some way to lose weight. Okay. But this may not be improving their metabolic health. All we see is a change in the number on the scale, but metabolic health may still be bad, or it may transiently improve, and then in the long term you're jeopardizing it in different ways. Okay. So yeah, I think that subtlety is really important, and I know some people who have been listening in on the podcast have started paying attention not only to the nutrients that they eat, but also making sure that they're doing resistance training, improving their musculature, right? Trying to increase and improve muscle mass, because again, your body composition is going to dictate how well you age. I can't emphasize that enough, right? So it's the if there's one thing I can get through to most practitioners is stop focusing on weight. Stop focusing on weight. First of all, it's a loaded subject, and it already is going to be something that will be sometimes, depending on the patient, difficult for the person to hear, right? Uh, and I think that anyway, it's not as important as the body composition. So, focusing in on metabolic health and body composition generally is a way where you can align yourself with the patient's interests, right? And you can be working towards a common goal that way. So, I think we need to start talking about, okay, so how do we optimize muscle? Right? How do we now, I don't want to get rid of all the fat, but I want to be selective as much as I can. Obviously, can't spot reduce, but you'll be surprised actually. Exercise seems to be really helpful in decreasing visceral fat, right? So if you can get your patients to exercise and be more physically active, you can impact that deposit of fat, in a significant way. So, these are things that we can try to guide the patient towards rather than just a number on the scale, right? So that's one of the reasons that the book that I'm writing is focused on body composition, and also I think people don't realize too that your body composition impacts your immune health. Your body composition is going to impact, your vascular health, right? So I think you saw in the shrunken brain syndrome episode, right? If you have increased, especially visceral fat, then you have basically poor perfusion to the brain. So this is a fat deposit in your body that's impacting your vascular health, delivery of blood and nutrients to the brain, and also likely to some other parts of the body. Okay, because of endothelial dysfunction. So there you go, your body composition is impacting your vasculature. It is impacting immune status, because if you have a lot of visceral fat, then you have a state of chronic inflammation, and the fat produces a lot of inflammatory cytokines that will impact, certain immune cells. Okay. So now if we're talking about immune function, that body composition is really important. Okay. Energy regulation, obviously, really important with the body composition. But also things like aging, senescence in cells, that's impacted by your body composition, right? Because if you have, let's say, a disproportionate amount of the sick fat, that is actually going to increase fibrosis and aging in other tissues, right? So, in terms of cell senescence, we're going to impact that with body composition, right? There's nothing that is related to your health that is not impacted by your body composition. And we need to start thinking that way. Anytime I see a patient, it doesn't matter what the disease is that they may have on their chart. Okay? They come to me with diabetes, they come to me with cancer, they come to me with COPD, they come to me with, I don't know, asthma, sleep apnea, a whole range of atrial fibrillation. I get a lot of those patients, right? I see that, and I can basically tell what I need to do with the body composition to kind of help the body repair itself, right? So take something like an arrhythmia, like atrial fibrillation. If you don't decrease that visceral fat, that is an irritant to the heart, right? And it's going to actually perpetuate the irregular rhythms in the heart. So it doesn't matter how many times you can do an ablation on that patient, they're going to have recurrence of disease, okay? Because you didn't get rid of the root cause, and that sick fat is still there. Again, your body composition, right? So you can have a patient lose weight, and this is what I see again. Patients will come to me and they lose X amount, and they may even lose a lot of weight, but they still have a lot of visceral fat. They're not done because their risk for recurrence of the arrhythmia is still pretty high, right? So if we don't start to educate our patients that way, they just think, oh, I just need to lose weight, 10, 20 pounds, 30 pounds. And this is how we talk about weight, right? Well, even 10 pounds will be good. It's like, forget that, right? You need to change that body composition. You need to get that sick fat down. Let's be real about this. So that's the part that I get still kind of frustrated with, because patients come to you and 9 doctors out of 10 have told them, pretty much all their doctors have told them, you just need to lose weight. Okay, and then here I am trying to explain the body comp and blah blah blah, and all they're thinking is, got to get 20 pounds down. And they're upset when they don't get 20 pounds down, right? And meanwhile, I'm like, given your age group, given your postmenopausal, yeah, it's not the weight I'm going after. I need to change your body composition, right? So that patient may have lost, let's say in 3 months, let's say they lose 20 pounds, but we've kept most of the muscle, and all of the weight loss was fat, and primarily the sick fat. That's very different from someone who's lost 40 pounds, okay, and lost a good proportion of muscle. But then tell you what, the person who lost 20 pounds will be upset, right? Oh, how come I only lost 20 pounds? Right? Well, because I tried to preserve your muscle mass. And it's that kind of nuance that I hope we start to just talk about a whole lot more. All right, I kind of ranted on that just because I see that so often. It's very hard to get people. And then I think it's still maybe new to some people, because now there's every day I see something like, guess what? It's not, your weight, it's the amount of fat that, and I'm like, yes, I've been trying to say that for 10 years. But yeah, you're right, Jean. Weight is an easy target, but that's the problem, right? We go after these easy targets without thinking about long term. This is how we solve a lot of problems. Have you realized, right? We don't like something, just get rid of that, and then we don't look at the downstream problems or consequences associated with that. We don't think beyond now and today. So I see this a lot in the medical world. We don't like that, we'll just remove it, okay? We'll give a drug, we'll stop this. And nobody's asking, well, what's the long-term effect, right? If we look at some of the obesity drugs that are now, I think, being recommended to the pediatric population, I don't know. I don't know the long-term effects on growth. I don't know the long-term effects on development, right? So, it's hard to say when people say, do you think that's good? I'm like, I don't think we know enough to say good or bad. That's number one, right? Number two is, again, right, downstream. So these people lose weight, kids lose weight, great. But their nutrients, they have nutrient deficiency. Okay. So now that impacts brain development, for example. So we know for brain development, we need a lot of healthy fats, the omega-3s, right? DHA, very important for brain development. Now, in a child, the brain is still developing. Everybody thinks, oh, well, it's like a miniature adult. But it's not, because brain development continues until, 20 years of age, 25 for men. Okay, so all this time the brain is developing, they're not eating. They have no appetite. They don't feel like eating. Okay, And that's good in the short term because they lost weight. Yay. All right. But then what's the nutrient status? How much nutrition are they getting for the brain? Are they getting enough of the vitamins and minerals? But are they getting enough of DHA? Right? Are they getting enough nutrients for the rest of their body? Who knows? Right? This is not just in the pediatric population, it's also in the adult population, right? Because again, I could sew up your jaw. I could just, wire your jaw and then you're going to lose weight, right? And everybody's going to be like, fine. I'm like, well, the nutrition isn't going to be the best, right? Even if you give that person TPN, parenteral nutrition through IV, you're not going to be giving them adequate nutrition, right? TPN, it's it's really just kind of, minimally helping, right? So if I wired someone's jaw shut and they lost weight, okay, that's fine. In essence, that's not different from using those medications, for example, right? Because the whole idea is that people don't want to eat and then they stop eating. How do I know? Because I have a lot of patients also who were put on the medications by their endocrinologists or other doctors, right? And they come to me and they don't have any appetite. Okay, that's good. For now, if you're only looking for pure weight loss, whether we're going to lose muscle, and if you are of a certain age, I'll bet you are, right? And then are you having other nutrient deficiencies? Probably. Probably because most people without restriction of intake already have poor nutrition and a certain proportion of malnutrition, right? So now we decrease that and supposedly that's okay. That's not. I mean, in the episode that I did on muscle metabolism, I think it was episode 4. And I talked about what happens when you have bariatric surgery, right? You lose lean mass. You lose a lot of lean mass. Okay. And, as you're aging, you're also losing. So now we accelerate the loss of lean mass. Long term, is that going to be good? No. I can't think of any instance where I think that would be good, right? To lose lean mass. So, I think again, quick and easy, just tell people to lose weight, right? But that is because we're simplistic about our approach. And now you are causing possibly more harm than good. So, like I said, I'm not against medication. I really am for the judicious use of medication. I have used medication on my patients. There's certain times when I feel that it would help. And also sometimes, interim period, it might just get my patient through, some difficult moments. So I'm not against that. I'm just against like simplistic, non-thinking use of medication as a quick solution without considering long-term consequences and what other systems you might be impacting in that patient, right? So all the time you hear, oh, but then everything gets better, the diabetes gets better, the this and that gets better. Well, I want to see what the lean mass is like in those patients, 5 years down, 10 years down. And obviously, after they've lost the weight, then you have to stop the medication. At least that's what it's like now. I mean, they might change that, and eventually, maybe people can, go on these medications indefinitely. And then I don't know what those consequences are either. Okay? I just think that we have to be very careful. You don't jump on board. I just find that people are so keen to jump on board so quickly, and new medications are good. They are helpful. I'm glad we have research, but I still would not jump on board so quickly. Yeah, I mean, I would not do that for my family members or myself, so I don't do that for my patients either. So, all right. Okay. Any other thoughts? I'm so happy to see you, Jean, today because I've heard so much about you. So um, it's fun to have you on. Yeah, I know. And like I said, hopefully with future episodes, I can start to also bring, highlight some of the connections between certain systems and pathways, right? I did not talk about the immune system much yet, and I did say in my newsletter that I would for this month, right? So I'm just going to probably do an overview of at least immune cells, um, in in the next, well, the one after this coming one, right? But um, again, this whole idea of your immune system, it's not disconnected from your metabolism, it's not disconnected from your body composition. So that is something that I definitely want to go into. Now, I do, just a quick plug, I have a video on YouTube, and it was a talk I gave at IGMC, and it was called The Magical Mystery Macrophage Tour. So it's just on one specific immune cell. And that's one that I hope people will watch, because future episodes, I'll be jumping off of that episode. In other words, I used that talk to give a general overview of one aspect of macrophages, really only one aspect of macrophages. So I just mentioned a very tiny bit about what they can do. And there's so many things they're involved in. So I'm hoping people will watch that as a general introduction to macrophages, because they are so much more interesting. I could probably do a whole year's worth of episodes just on macrophages alone, and how they're intimately involved in disease regulation, disease proliferation and regulation, right? So I and you can't talk about atherosclerosis, which is again a topic that I'm slowly making my way towards. You can't talk about atherosclerosis without talking about those macrophages, right? And just having people understand the complexity, and it's not just, oh well, you eat cholesterol and cholesterol clogs your arteries, and then then you have heart disease, and then you have a stroke or something like that. That's generally how it's understood in the general public, because that's how we explain it a lot of times in the medical world. That's how the medical world explains it to the general public, right? And it's not quite like that at all. um, and I was saying in the previous episode when I talked about lipoproteins, how it's interesting now, the shift, because before, everybody, in the medical school curriculum was like, cholesterol causes heart disease, cholesterol causes this and that. And I saw the shift in the language, and now it's oxidized LDLs, right? And I made the point that oxidized LDL is just modified LDL in any form, and it could be the cholesterol components that are modified, but there are many other components that can just as well be modified, right? So it's now shifted to understanding that we're going to be looking at oxidized LDL and the inflammatory response from LDL. Manchester United predictions this season, I have no clue. Um, Actually, not a huge sports person in any way. I think my friends would probably agree. Um, so, I mean, I like watching soccer or football around World Cup time, mostly because it reminds me of home and growing up with friends and family members playing soccer mostly. So it just kind of is familiar, but I have not been following the teams and so forth. So I don't, I don't, I have no clue on what Manchester United would do. All right, if you have any ideas, then you can let us know. And anyone else with questions? No? All right. Well, I think then we can maybe end right here. Couple of things I just want to remind people on my website, VyvyyaneLoh.com. And I know I have to spell it because my name is spelled differently. So it's VyVyaneLohMD.com. And I encourage people to sign up for the newsletter there. That way, um, we'll be able to, you'll be able to see some upcoming sort of topics for the podcast. And also to get your comments and your suggestions. And there's someone called Aka Mayahu. Well, thank you for joining. I'm just trying to read all the different names there, and it's nice to see some new people joining. And I hope that you've been enjoying the different episodes. And again, I always ask people, if you want me to talk about something, just let me know. I'm mostly interested in anything related to the body. So people go, what can you talk? I'm like, well, everything is fascinating to me in the human body. I do have some probably favorites. So I love macrophages and immunometabolism. That's a huge one for me. And anything related to fat in the fat cell. I am, after all, specialized in obesity medicine. So I'm very interested in fat and regulation of fat tissue. So those are some of the big ones. And of course, muscle. So, when you say fat, then you have to say muscle. When you say muscle, you have to say bone too, because they're all related. So body composition is a deep interest, right, for me. But anything else, I'm very interested in immune disease, autoimmune diseases, for example, vasculitis, neurodegenerative diseases in the brain, so dementia, different forms of dementia, not just Alzheimer's type, different forms of dementia, and Parkinson's, Huntington's, different neurodegenerative diseases. Those are important. And also infectious disease. So I almost wanted to be, when I was in med school, I thought I would do ID, I would do infectious disease. And I ended up not doing that. The two things I wanted to do were infectious disease and ICU, because I really enjoyed ICU as well. But I didn't end up doing either of those. But they're still big interests of mine. So, any ICU related topics are also very interesting to me. So there's nothing really that I can think of. I'm not really interested in the body. I'm trying to run my head through a list of topics, and I can't think of anything that I wouldn't be interested in. So whatever you'd like me to discuss in medicine, I'm sure that's going to be something that I would love to do an episode on and present. All right, so I'm hoping that you will send me your suggestions. Go to the website. Also, just comments on YouTube or on LinkedIn or all the other places you can find me. Okay, so right now I'm going to say bye for now, and I'll see you next time at the next Q&A. Okay, take care, everyone. Bye.